everyone, I'm Gavneet Kaur Pruthi, practicing clinical and child psychologist in New Delhi. We often have heard about eating disorders in children and adolescents. Today, let us see what are these eating disorders in children and adolescents and why you should consult the clinical psychologist or the child psychologist for these disorders. Without wasting any time, let us see what are eating disorders. Eating disorders in children and teens cause serious changes in their eating habits that can lead to major life threatening health problems. The three main types of eating disorders are anorexia, a condition in which the child refuses to eat the adequate calories out of an intense and irrational fear of becoming fat. Anorexia, in which a condition a child refuses to eat the adequate calories out of an intense and irrational fear of becoming fat. In the bulimia condition, in which the child grossly overeats, binging, and then purges the food by vomiting or using laxatives to prevent the weight gain. So, in anorexia, the child is eating less amount of food. In bulimia, the child is eating, grossly eating, and then vomiting. Okay. Next one is binge eating. It is a condition in which a child may gorge rapidly on food but without purging. Child will not vomit in binge eating. In children and teens, eating disorders can overlap. For example, some children alternate between periods of anorexia and bulimia. Eating disorders typically develop during adolescence and early adulthood. However, they can start in childhood also. Females are much more vulnerable for eating disorders, and only an estimated 5 to 15% of people with anorexia and bulimia are male. With binge eating, the number rises to 35% male. Now, what causes the eating disorders? The doctors aren't certain. Doctors are not certain about the causes of eating disorders, but they suspect a combination of biological, behavioral, and social factors. For instance, young people may be influenced by the cultural images that favor bodies too underweight to be healthy. Young people are influenced by the media and by the actors and actresses by the cultural images that they see on the media that favor the bodies too underweight to be healthy. Also, many children and teens with eating disorders struggle with one or more of the following problems, like for example, distress, feeling of becoming overweight, feeling of helplessness, depression, low self-esteem. To cope with these issues, the children and teens may adopt harmful eating habits, and in fact, eating disorders often go hand in hand with other psychiatric problems such as anxiety disorders, depression, and substance abuse. Now let us see what are the dangers of eating disorders. Eating disorders in children and teens can lead to a host of serious problems and even death. If you spot any signs of eating disorders, then call your doctor away. Eating disorders are not overcome through sheer willpower. The child will need treatment to help restore normal weight and eating habits. Treatment also addresses the underlying psychological issues. Remember that the best results occur when the eating disorders are treated at the earliest stages. So, other symptoms in eating disorders, like for example in anorexia, include, which is a type of eating disorder, anxiety, depression, perfectionism, being highly self-critical, dieting even when one is thin, excessive or compulsive exercising, intense fear of becoming fat, menstruation that becomes infrequent or stops, rapid weight loss, strange eating habits such as avoiding meals, eating in secret, monitoring every bite of food, or eating only certain foods in small amount, unusual interest in food. Anorexia can lead to serious health problems, and these problems include damage to major organs of the body, like for example brain, heart, and kidney, irregular heartbeat, lower blood pressure, body temperature, breathing rates, sensitivity to colds, thinning of bones. The most common causes of death include in anorexia are cardiac arrest and electrolyte imbalance and suicide. The first aim for the treatment to bring out is the person back to the normal weight and eating habits. Hospitalization, sometimes for weeks, may be necessary. In cases of extreme or life threatening malnutrition, tube and intravenous feeding may be required. Long term addresses psychological issues. Treatment includes antidepressant medications, behavior therapy, psychotherapy, support groups, etc. So if your children are have started engaging in eating disorders, or they are in eating disorders, please consult clinical psychologist as immediately as possible. I am one of them, and because these are very severe conditions which also sometimes needs hospitalizations and treatments in the hospitalizations, because the body weight is going very down in these children beyond the normal weight. Their body weight is going down, and they are not eating because they have the disorder, and they are not also behaving properly because they have the disorder. So with the help of the clinical psychologist and the psychiatrist, you can manage this condition very properly with the help of medication, with the help of hospitalization, and with the help of counseling and psychotherapy. My numbers are also given below. If your children are facing eating disorders, the types of eating disorders, any type of eating disorders which I have mentioned, please consult clinical psychologists as soon as possible, so that we can help you to manage this condition, so that this condition does not interfere with other areas of the child's life. If you like my video, then please click the like button, and if I have missed anything, then please write in the comment section. Thank you so much.